Okay, good afternoon, everybody, and welcome along to the VRBAC MULTIMIN research webinar. I should say good morning and good evening. I know we've got a few international visitors as well. Don't worry, my name is Matt Wells. I'm the Technical Services Manager here at VRBAC. I'm not going to speak for too long. I'm going to hand over to our very special guest star, Andrew Bates, in just a moment. I don't think I need to do too much introduction of Andrew. You've probably been looking at his profile while you've been waiting to come into the webinar anyway. But probably the important things on there are that he is the Head of Research and Education at VetLife, which is great because we need to be educated about some research today. It should be helpful. And he's also, for those that aren't aware, he's the scientific editor at the New Zealand Vet Journal these days. But of course, for most of us, I guess we know Andrew is the author of lots of very high quality published papers in recent years, including a couple on MULTIMIN, of course. And this represents the next instalment in the continuing saga, I suppose, of MULTIMIN research. So without too much further ado, I'm going to hand over to Andrew, but just very, very quickly, a little bit of housekeeping. You might notice that you are automatically muted and you can't unmute yourself. It's not because we want to shut you all up, well, that's probably just an added bonus. It's more just to make sure that there's not too much background noise or anything. What it does mean is that if you have a question, you'll need to type it into the little chat pod that you can see down in the bottom corner there. So by all means, type in your questions. What we'll do though is just wait until the end and we'll just address the questions when we get to the end of the presentation. So with that, I think I will hand over to Andrew and say a very warm welcome, and I will come back in at the end and ask the questions that come up throughout. So Andrew.
Okay, well, thank you very much, Matt, and thank you very much to everybody who's here this afternoon for this webinar. I'm going to try and talk for 35 to 40 minutes, so hopefully not too long, and hopefully a bit of time at the end for questions, as Matt said. And what we really wanted to do was share with you the results that we've got from the trial that we did, essentially trying to look at whether MULTIMIN given pre-calving could have some beneficial outcomes in terms of health status for cows. There's a lot of people who are involved in this study, and I've listed the ones there, but I particularly wanted to make a big shout out to my colleagues at VetLife, who are endlessly patient in recruiting farmers and helping to organise what goes on the farms when we recruit them, and for collecting samples and doing extra work at a very busy time of year. Also, none of this would be possible without the financial support of VRBAC and VetLife, so I definitely want to acknowledge those two as well. So what essentially we were trying to do is we were trying to set up a trial that would mimic fairly robust and standard farming practices for our particular area of New Zealand. So we took 4 commercial herds from Otago and Canterbury, and it was just a convenient sample, recognizing that there are issues with that. Our inclusion criteria were very relaxed. They had to be regularly injecting their animals pre-calving with an anti-scour vaccine. We needed this because we needed to muster them to inject them with MULTIMIN, and we needed a reason that they were doing that already, so that we weren't imposing an extra drafting and mustering for those cows. They also had to have ProTrack so that we could identify animals easily and have some chance of being able to track the animals through the trial. And the most important thing, as is always the case, they had to be happy to be involved, and essentially they had to be people that we would feel we were confident would comply with the things that they needed to do. So it may not be representative of every herd in New Zealand, but it's the best that we can often do in these situations, and it's a practical way of running trials on farms. So the design of the trial was deliberately pretty straightforward. And essentially what we wanted to do, in a nutshell, is take a bunch of cows and inject half of them with MULTIMIN and half of them with controls. And then we wanted to collect colostrum samples from them after calving, and we wanted to follow some health outcomes. So that's essentially what we were trying to do. And to make that happen, what we did was we identified those 4 farms, and 14 to 28 days before they were going to be dried off in the preceding lactation, we blood tested 10 cows at random from each herd. and we just assayed them for copper and selenium in the serum level. And in no way are we trying to do a detailed workup of the mineral status of these farms. All we're really trying to do is rule out any outliers, so that if the farms were really, really low or really super high, then we would have an issue with that farm and we would have rejected it and moved on. And we also wanted to monitor the status of them at calving as well, and the same sorts of reasons. We just wanted to make sure that things were relatively normal, and they were. And that's probably all I'm going to say about the serum assay. And then the main part of the trial was 14 to 28 days before planned start calving, when they were going to be drafted in for their injections of anti-scour vaccine. We had randomly identified 400 to 450 cows on each farm that were suitable for our purposes, which meant that they had to calve within about 7 days of the midpoint of calving. And within that, we stratified those cows on the things that we thought were likely to affect the outcomes we were interested in, which, because we were interested in mastitis primarily, was things like the cell count in the preceding lactation, their age, and their breed. And so we made sure that the two groups that we ended up with were equally balanced for these three confounders. And then at random, half of them got MULTIMIN, 5 mils, and half were sham injected. And that meant that the distribution of cell count, age, and breed between our treatment group and our control group should have been the same. And we checked afterwards, and it was. But that was why we did it, so that we could, to some extent, adjust for those likely factors that might affect the outcomes we were interested in. Then at calving, we collected up to 100 colostrum samples within 24 hours of calving from each farm. And we also took another check blood test from 10 randomly selected cows on each farm as well. And then after calving, we followed all 400 cows on each farm up for up to 100 days. And we got clinical mastitis records, subclinical mastitis in terms of herd test data, and MetriCheck records from when they were MetriChecked at 14 to 28 days after calving on average. So we had some exclusions, and as you'd expect, they're fairly predictable. Things with 3 teats, poor teat end erosions, calluses and sores and things on the end of the teats. We got rid of those just because they are likely to have a different kind of outcome, which is atypical. And the key features really that we try to do, we wanted something that was very robust. In our experience, the more straightforward and simple we can make these things, the more likely you are to get complete data sets. That has pros and cons. It limits the sorts of questions that we can ask, but it means that we are constrained to construct fairly robust protocols. We have been able to control for some of those major confounders in the way we set it up. And once we injected everything, everybody was blind to the status of the animals. We knew who the trial cows were, well, I did, but nobody else did. And the farmers and the farm staff and the vets and the vet staff who collected the samples didn't know either. There are some drawbacks, of course, there always are. The main one really is that we only had 4 farms. We have lots of cows, which is nice, but more farms would have been better, if I'm honest. It's difficult, though, to recruit more farms. It's easy to find a few farms than it is to find a lot. And we also needed quite large farms because we had to get large numbers of cows calving over a short period. And so that did constrain the number of farms that we could recruit. So inevitably, there are still some uncontrolled confounders, the ones that we know about that we can't control and the ones that we just don't know about as well. And the other comment, I suppose, is that it's a fairly crude level of observation that we're doing. There's some obvious issues that you'll all be thinking of, I'm sure. One of the big ones with the colostrum quality is that, as we know in New Zealand, cows are usually milked out after calving once in every 24-hour period. So there's up to 24 hours between when she calves and when she's actually drafted and milked for the first time. And so clearly there's a lot of variability between cows in that time. Some calved that morning, some have calved up to 24 hours previously. Some of those cows will have been sucked as well, and that will obviously make a difference. We're also relying on clinical records, and there are some issues with those, and we'll see some of those as we go through. But just as a note, we were interested in the first case per cow or per quarter. So we weren't trying to follow repeat cases in the same cow in the same quarter, just the first case. And we only looked at IS cell count data once. So essentially, we identified the herd test when the cow was first milked and tested after calving, and that was our point, our point line in the sand. And we didn't do any bacteriology. Good, but expensive. So we didn't do that one. So it's what we got out. What we came up with was we had 1,700 cows that we recruited. We were aiming for about 1,600, 1,700, so that was all right. And we had about 1,655 with complete records, which wasn't bad. And that's partly because these were very good compliant farms with good record keeping and very cooperative staff and managers. And out of that, slightly less had complete cell count records. There was nothing nasty in the cows that were missing. There was no difference between the treatment groups, and there were no sinister reasons as to why they weren't there. So essentially, our two groups still remained nicely balanced. In terms of outcomes, we had 347 brick samples, which was very good, and that's a great credit to my colleagues. So we were aiming for a max of 400, so I was really pleased. And anywhere over 200, I was in bonus territory. We had 81 cows with mastitis and 287 quarters with mastitis. Now that's quite a lot of quarters, and I'll talk about that in a minute. And then we had 267 cows with a cell count at the first herd test over 150,000, which was our cutoff point for calling them subclinically infected. And then at MetroCheck, 195 cows were positive. You know, they had some sort of custard in the cup when we examined them. Now, that 287 quarters, it is high. If you do the sums, 81 into 287, you're ending up with 3 and a bit cases per cow, and that was quite high. And there's a few reasons for this, I think. Some of them are genuine multi-quarter cases at the same time. So a cow comes in and she's got 4 quarters affected. That's okay, it's understandable. Some of them are repeat cow cases, but different quarters. And so again, they're legitimate. We can include those. But there are some, and it's difficult to know how many, that I think are overdiagnosis and treatment. When I look through the treatment records on these farms, quite a lot of these cows are treated with injectables. And quite often it's just all 4 quarters are ticked. And I wonder whether they really are all 4 quarters infected, or whether it's 1 or 2, and they've just opted for whatever reason to treat with injectable. No criticism or anything in that comment. I'm just trying to understand why I have quite a lot more quarters than I do cows. The good news for us was that there was no difference in that tendency between the treatment groups. And also, when I analysed it at both the cow and the quarter level, the conclusions are exactly the same. What I'm going to show you this afternoon is all based on cow level analysis. So hopefully that will not cause you any concern. But I wanted to bring it to your attention because you might well think, well, that's a lot of quarters, Andrew, what was going on? Okay, in terms of had we managed to stratify our groups? Well, yes, we had. They were nicely balanced for those likely confounders that we could identify. And then just a quick recap of what I'm talking about is confounding. And I like this because I'm increasingly getting anxious about the thing on the right as I'm getting older. And it's a nice example of confounding, but apparently in the States, if you move to Florida, there's an association with you getting Alzheimer's. And so you can draw a little causal diagram like this, which suggests that if you're old and you move to Florida, you get Alzheimer's. But clearly that's rubbish. It's nothing to do with Florida. It's the fact that you're old. And it doesn't matter where you live, even in New Zealand, you can still get Alzheimer's. And so it's a spurious association because old people are associated with living in Florida and old people are associated with Alzheimer's. So in our sense, if we had had an association between age, for example, and whether or not a cow got supplement, a trace mineral supplement, that would have created confounding. And we didn't have that. There was no link because the groups were balanced between age and supplement or not. And so we have 2 independent variables working on whether or not the cow gets mastitis. And that was useful for us to see. Gives us more power, more bang for our buck, basically, in terms of the analysis. So let's get into what we actually got. These are the bricks readings. We did this in-house. Again, my colleagues did a lot of it. I did some, but they did most of it. And we used the refractometer that you'll all be familiar with, 347 samples. And the little graph on the right is just a histogram of the distribution of bricks values along the bottom with a count of colostrum samples up the side. And those distributions are pretty similar. Blue at the top is control and red is TMS, trace mineral supplement. And I keep those colors all the way through. If we just do a straightforward unadjusted comparison, so just not trying to allow for any differences in the groups at all other than just are the numbers different, then yes, they are. The median difference, because those aren't normal distributions, is 0.13 on the brick scale. Now, I've called it BR for bricks reading. I know it's a percent, but there are a lot of percentages in this presentation with confidence and probability and stuff. So just to keep it straightforward, I've put BR. And the 95% HDI, which effectively you can think of as a confidence interval, although it's better, and I'll explain why in a minute, is from minus 0.9 to plus 1.2. Now that HDI is highest density interval, or more usefully, highest credibility interval. And essentially what it means is that we are 95% certain that the most likely value for the difference between the Brix readings between control cows and TMS cows is from -0.9 to 1.2. And we are confident that the most likely value is 0.13. So it's what you want a confidence interval to be, but in actual fact isn't. And that's one of the reasons why I like them, because it actually says it is what it says on the tin. So it's a really small difference. If you think that you're looking for a Brix of 22 or more, as gold standard, 0.13 is neither here nor there. It really doesn't matter. And then we did some more sophisticated modeling where we try to adjust for the other variables. And what we do here is we're estimating for the average cow in the study, and we're allowing for the fact that there might be farm level factors that mean that cows within the same farm have similar readings, and so we're adjusting for that. And when we do that, what we get is we get a probability distribution of the likely Brix readings. And that's this over here. I'm hoping you can see the pointer, because I can see it on the screen that I think you can see. And we've got two probability distributions with predicted Brix readings along the bottom, and the density, which you can just think of amount of stuff. It's the amount of probability effectively under this curve. And the blue ones here are the control cows, unsupplemented, and the red ones are the supplemented cows. And because it's purple mostly in the middle, they're the same. They are overlapping each other to makes no difference. When you actually calculate what the average Brix will be for a typical cow on this study, without TMS, it's 21.98 is the most likely value, and 95% of them are between 18 and 26. With no TMS. With TMS, it's 20, 22, 21.56, 22, both of them are the same. And again, the range of the most likely values is identical. There's no meaningful difference in those two figures. If you work out the actual multiplier of the difference, effectively what it means is that TMS cows are 98% of the value of Brix cows, but that percentage can actually be anywhere from 94 to 103. So it spans the null value of 100. If you're looking at the absolute difference between them, it's -0.38, which again is nothing when you're thinking about the target that you're going for, 22. And that difference can be anything from -1.31 to 0.5. Again, it's slightly different because of the multi-variable nature of the analysis than the straightforward unadjusted one. So essentially, it's the same. But when we're trying to say whether something is the same or not, it's not enough just to put up a graph with two things that are overlapping. You actually have to say, well, what is the difference? And how is that difference? What shape is it? What does it look like? What's its variability? And so this is the next thing that we're going to do. And there's going to be a few of these, I'm afraid, so I hope they're not going to be too horrible. This is a probability distribution of the Brix readings, or the difference in Brix readings that we're getting. So along the bottom here, we have the difference in the mean Brix readings between the treatment groups, between the TMS cows and the control cows. So 0 is no difference, -1 is less, and 1 is more. And that's Brix reading here. So it's the distribution of estimated probabilities of the probabilities for the different values of the difference. So here we have a difference of -1. Here we have a difference of -2. So a -1 difference is more likely than a -2 difference. That's because it's a probability distribution. And it's between the Brix values of colostrum of cows with and without trace mineral supplement. So it's giving us an idea of the range of the differences and what's the most likely value of that difference, and how does the probability change as the difference changes. So it's much better than a confidence interval. The important thing is it sits either side of 0. Okay, so there's some values that are more and some values that are less. The 95% most likely values are between -1.31 and +0.5, marked by this thin line along the bottom. This is the 66% most likely values, the thicker line, and that's the most likely value here, the single most likely value. So we're really quite confident, if you like, that the single most likely value is this. That's the highest probability here. And we're also pretty confident that 95% of them, we're 95% pretty confident, are in this value here. Okay. And overall, 91% are within ±1. Now when I started this analysis, in my head, I had, if it's within ±1%, it's the same. It's so near as damn it, it's the same as to make no difference. So for me, that's quite good evidence that the Brix value difference is negligible. to non-existent. And hopefully it is for you as well. If you feel like this, I sincerely apologize, and I hope that as we go through this, it will make a little bit more sense and they'll become a little clearer. So here it is again. It's the probability distribution of the different values of the difference. So we can have different values of difference here. We have a positive difference, we have a negative difference, and they have a different probability of occurring. What we're interested in is what's the average, which is this one, and how confident are we that it is that value, and we're very confident because it's right at the peak of the curve. And what's the range in the values that we're likely to see. So overall, what we get is, in a nutshell, Brix readings, no difference whatsoever. Okay, clinical mastitis. Now, I didn't get you out here this afternoon just to listen to a whole series of things which made no difference. So the next things, there was a difference, you'll be glad to know. So this is the overall results from -7 days before calving to 100 days after calving. And we got 50 cases in the controls and 31 in the supplemented groups, and those are the percentages broken down. And if we just do the straightforward comparison, we get a median difference of 2.3. And again, this interval, trying to describe what the range of those differences is, excludes 0. Okay, so we are 95% confident, at least, you'll see later, that it's not 0. It's more than 0. It's real. The risk ratio, if that's more familiar and comfortable, is 0.62. And it excludes the null, which for a risk ratio is 1. So we can again be pretty confident that this is a real effect. When we do the multivariable analysis, same setup, trying to adjust for the fact that cows are nested in farms, then we get this distribution of predicted probabilities for mastitis. So this is the predicted probability of mastitis for the control cows, peaking at about 4 or whatever it was we said. And this is the predicted probability for the TMS cows, peaking at just under 2.5. There is a bit of overlap, but not much. But the reason why we have to look at the scary graphs is because how much is not much, and is that a real difference or not? So when we work out from the model's predictions, allowing for all the adjustments of cow and farm and age and cell count and all the other things that might confound the results, the model says without supplement, there's a 4.3% probability that she'll get mastitis, and it's anywhere from 3 to 6.5, but it's most likely to be 4.3. With supplement, probability reduces to 2%, and it's somewhere between 1.5 and 3.4, but peaking at 2. Okay, so odds ratios, 0.51, and median difference, -2. Again, both of them are excluding the null. So they're real differences and not sort of verging into ambiguous territory. Despite this area of overlap here, the actual value of the difference is real. So here we go again, another one of these, I'm afraid. This is the probability distribution of the differences between the probability of a cow getting clinical mastitis with or without trace mineral supplementation. Again, we've got difference in the probability of clinical mastitis between the treatment groups on the bottom, and we've got the amount of that probability up the axis here. This one all sits below 0. Here's 0, and here's my region of probable equivalence, where basically I'm saying it's in there, it's the same, because plus or minus 1%, who gives a damn? You know, it's too small to make a difference. 95% of my most likely values are sitting in a range of -3.4% less mastitis to -1.1% less mastitis. So I'm below my critical region of 1. My single most likely value, if I have to guess and say, okay, Andrew, what is the difference going to be? I'm going to say it's -2% in this herd, in these herds. For this set of cows, it's -2%. It's the single most likely difference I'm going to see as caused by trace mineral supplementation. And 98% of all my values are actually less than -1. We go through these graphs. The gray bit is the bit that you're interested in. The blue bit is bits that are in the 1 minus plus or 1 region. So they're where there's no difference. Okay, so let's look at this in a different way, because it's always quite good to see things in a different viewpoint. Because probability may not be your thing, and fair enough, it isn't. This is a Kaplan-Meier survival analysis curve, which is a different way of sort of doing the same kind of thing. And it's essentially just saying, let's look at the data and let's see what the data say about the differences in survival of the two groups. So it's not sort of a regression as such. It's just saying, what's the data? What's the data doing? Draw it out, and how does it fall? And when we do that, we see that there's quite a difference in the survival between the two groups. So up the left, we've got the percentage of cows without mastitis, and here we've got days since calving. Now, there's a good reason why I've gone up to 30, and it's because actually when I analyze this data, the proportional hazard assumption is violated in this data set, which means that all the effect is early on, and that the effect of trace mineral supplementation is in the first 30 days. And that's why I've only shown you the first 30 days of this analysis, because otherwise I need to do other things to make it work. So what we get is we get two survival curves. We get the treatment cows, which get mastitis less, and we get the control cows, which get mastitis worse. From day 30 to day 100, these two curves carry on, and cows get mastitis in both of them. But essentially, after this point, they're getting mastitis at the same rate. So if you analyze it out at day 100, you certainly see a difference, and it's the same difference as you get here, really, but it's because of this difference here. It's this bit of the curve where the rates are different. This is the stuff, this bit here is what generates that difference here and further on, okay? So that's why there's only 30 days in here. It's not, I'm not trying to hide anything, I'm trying to be as honest and upright as I can, and it's because the effect of trace mineral supplementation appears to be in the first 30 days. And that makes sense because it'd be hard to believe that it could last for an extended period. Okay, so a roundup really is what we get. We give animals multimin trace mineral supplement at full calving, and we get at least 1% less mastitis in the supplemented group. And in this trial anyway, and the average reduction was 2% in this trial. The odds ratio for that is about a half. Okay, and it excludes the null quite nicely of 1. Okay, so subclinical mastitis. Now, for this trial, we define that as cows with a cell count plus or minus 150,000, and we can talk about that a bit more if people want to later on. And looking at the two groups, again, we have a control group and the supplemented group, and we get the percentages of cows with cell count more than 150,000 at the first herd test after calving in those two groups, and it's just under 20% for the controls and just under 15% for the supplemented cows. When we do a straightforward comparison, we get a difference of 5%. And that 5% difference estimate excludes 0. So again, our most likely value for that difference is 5%, and we're 95% certain it's between 1.4 and 8.6. The risk ratio is 0.75, okay, slightly higher, but it still excludes the null of 1. And when we actually look at the actual cell counts of those cows, this is the sort of distribution that we get. So this is a histogram showing the cell count at the first herd test in thousands along here. And there are some, obviously, there always are some bad counts. And this is the count up the side here. There's no actual difference in the median between these two distributions, but there is a difference in this bit in the 75th percentile. And believe it or not, the 75th percentile for both these distributions is right down here, because these lot up here are just 1 or 2 cows out of the 1,600 or so. It's really small numbers up here. Okay, so all the action is taking place down here. And what the supplement appears to be doing, or the association that we see, is that we get a change in the population distribution of cell counts, so that the 75th percentile is actually changed between the two groups. It was 94,000 for control cows and 73,000 for trace mineral supplemented cows. So the difference of about 20,000. Okay, so again, we do a multivariable analysis, and this is what we find again. This is the distribution estimated of the probability of subclinical mastitis as defined by cell count over 150,000 between control cows, which are these blue ones, and supplemented cows, which are these red cows. More overlap, as you see, but what we need to know is that a real difference between that value at the peak and that value at the peak and the rest of it? Are those two distributions different? So if we estimate the mean, or median probability, of these control cows, 17%. And if we estimate it for the supplemented cows, it's 13%. Is it different? Okay, the odds ratio, 0.72, and the median difference, -4. So it's looking like it is different. Yes, it is, because our values for these two things, exclude the null in both cases. So we're nowhere near, we're not up to 1, and we're not up to 0 here. We're still below 0 here. Our difference is still negative. We're still getting less mastitis. So here we go again, I'm afraid. Running out of analogies for here we go again. So I'm scraping the bottom of the barrel with this one. So this is subclinical mastitis again. And again, here we have the distribution of estimated probabilities for the different values of the difference between the probability of subclinical mastitis, of cows with and without trace mineral supplementation. So most of it is below 0. Not as much as before because the curves overlap more. The 95% most likely values are between -9.3 and -0.5. Okay, so I'm encroaching into my null value of bugger all difference, but I'm still not getting to 0. The single most likely value is -4% difference. And 95% of all values are more than -1, i.e. more negative, because you've got this tail down here. These values aren't as likely as these values over here because it's a probability distribution, which is why we have these two differences here. But don't get too wedded about whether it's 95 or 90. What this is basically telling you is that overwhelmingly, the differences in subclinical mastitis are that you get less of it in supplemented cows, okay? And that this area here is pretty small, and the area that's more than 0 is vanishingly small, okay? So the effect is all this way, all on the negative side. Okay, so we get at least 1% less mastitis in the supplemented groups. Average reduction is 4, and the odds ratio is 0.72, and that range is 0.54 to 0.95. So again, it's excluding the null value of 1 for an odds ratio. Last thing, I think, PVD, purulent vulval discharge in cows, at cow level, obviously. The diagnosed at MetriCheck, these herds are under a regular schedule of MetriChecking 14 to 28 days after calving. And it was a routine on the farm that they would be MetriChecked. And all we've done is say MetriCheck yes or no. We haven't tried to categorize it. There just really weren't enough cases to do that. I suspect that this is an underdiagnosis because the numbers are quite low, but there it is what it is. So we had 12% in the control cows and 11% in the TMS cows. So that doesn't look very different. And these are the estimated distributions of that, of what the 95% most likely values are for that. And when we compare that difference, it's -1%, but it could be anywhere from -4 to 2.2. So it spans 0. So we've got both negative and positive differences. So this is looking like it's not a difference. It doesn't look like there's any difference between these two groups. The risk ratio, 0.93. Okay, so it's less than 1. But again, look, the 95% most likely values span 1 on both sides by nearly the same amount. So it's as likely to be less as it is to be more, which means it's the same. Okay, oh, that's gone wrong. So we've got a mixed model in the cow. And we've got the two distributions of the probability of purulent vulval discharge between the two cows, overlapping to a great extent. When we pull this out and calculate the probability that we expect for cows that are not supplemented, it's 11% a bit. And with TMS, it's 11%. So the probability really is not going to be different. It's certainly not looking like it's different. When we do the sums, the odds ratio is 0.91. And this is multivariable, remember, so it's slightly different from the univariable analysis because it's allowing for the other things. And it spans the null value of 1. And the median difference, which you're likely to see on a particular farm in this study, is -0.7. So it's saying, oh, you can see less PVD. But look at the range of that difference. We're saying it's anywhere from 5.5 to 2.6 minus to positive. And so we can't say that that is a real difference. If you plot this out, and I've shortened this because I thought you'd probably all be well fed up with these things by now. This is that distribution of the differences in the probability of the two things. So it's the difference in the mean probability of PVD between cows getting supplement and not getting supplement. And here's 0, and here's a whole bunch of values where we get less PVD, and here's a whole bunch of values where we get more PVD. Now, yes, there is slightly more of this probability distribution on the negative side than there is on the positive side, but not in any meaningful way. It's nowhere near 90%. I can't remember what it is. It's 72%. I've got it written down. 72% of all this difference here is less than 0. Now, 72% certain of something is not very certain. And certainly, most of the time, people are looking for levels of certainty of around 90 to 95% before they'll sort of say, yeah, that's believable. So there is no difference with PVD. Okay. So in summary, I'm nearly wrapping up. There are many parts to a picture. There is a cow in there. I really like this work. Here she is, part of her anyway. And here's another bit. And what I'm trying to say here is, A, it's a nice picture. And if nothing else, you get to look at a nice picture if the rest of it's been terrible. But what I'm trying to say is that there are many strands that go together to pull together what I'm trying to find out and what I'm trying to assess in terms of whether supplement has made a difference. And we've looked at different outcomes and we've looked at them in different ways. And this last slide really is trying to bring all that together. So TMS supplementation before calving, does it do anything? We found no difference in the Brix value of colostrum, and we found no difference in the number of cows that were MetriCheck positive. We found a reduction in disease, though, for mastitis. Clinical mastitis in the first 30 days, and we reduced that. The odds ratio is about half. And subclinical mastitis at the first herd test, the odds ratio is about 3/4. Okay, and both of those are real, in inverted commas, because the estimated likely values all exclude the null, which is 1, remember, for an odds ratio. An odds ratio 1 means no difference, and both times we're below that. So we're pretty comfortable that we are getting this effect. It might be small in this particular herd because the level of cow level mastitis we were getting was small. We were only getting 2 to 4% mastitis in these herds. And so we can't reduce that by 5%. We can't get to negative mastitis. But the odds ratio is reasonably robust across different farms. Although the probability will depend on a whole lot of other factors that depend on how much mastitis that farm gets. So there you go. That's it. 35 minutes, just about. Thanks ever so much for listening. I hope it's been of some value. If not, let me know. And I'll be very happy to take any questions, and I'll try and answer them to the best I can. There's a comment from someone in South Africa, and thanks very much for beaming in from South Africa, saying that they have very high levels of iron in the soil and grass, and they know it's a major antagonist to the gut absorption of copper. They started injecting calves with 1 ml of MULTIMIN within the first week of being born, and it sorted out the copper deficiency, showed visible increases in calf growth, and also had a great effect, having less of the yellow toothpaste textured diarrhea caused by the low copper levels. Well, I'm very glad to hear that. We certainly, we did that study 2 or 3 years ago now, where we were looking at multivitamin supplementation at birth of calves in the New Zealand pastoral system, and we found it was very effective. We couldn't determine a difference in growth rates, but we did show that the disease and mortality was reduced, especially from that injection given first off. If you can hear me, Matt, give me a thumbs up if that's all right. Oh yeah, okay, I'll carry on rabbiting then. Question from Winston, which says, hold on, can't get it to go down. Here we go. Just wondering what other mineral supplementation have been given on the farms, and did you exclude based on that? They were all on a supplementation system. What we tried to do was one of the criteria, and I should have put it in, good spotting, Winston, was that they were all effectively on a similar routine of a water-based mineral supplementation through a dosatron. And they were all using a custom blend that is common around here, which has, I can't remember if I've got it off the top of my head, but it's got the normal culprits of copper, selenium, in it. And they were also getting macrominerals like magnesium and calcium as they got up to and after calving. The important thing from our point of view was, I suppose, to make sure that there were no outliers, that there weren't any weird farms that had no supplementation at all, or absolutely ridiculously high levels of supplementation, because that would have screwed that farm's influence on the results. But so long as they weren't, any farm level factors like that just get amalgamated in the total dustbin term of farm effect, just like different management styles, different pastures and so on do as well. So we took the view that we needed to exclude outliers, but after that, we were less interested in the mineral supplementation situation per se. And in the past, we found that trying to quantify the effect of TMS supplementation through things like blood testing in particular, but even liver biopsies, is just not very useful because it's too variable and too imprecise, really, I suppose, in my experience. But I'm happy to be corrected by people who know a lot more about minerals than I do. Another question here from someone says, with the mastitis data, were the cows all given the same dry cow therapy, teat seal, dry cow, etc.? No, they weren't. Again, that's a potential issue that I wondered about. But on each farm, all the trial cows were. So on any one farm, whether she was a control cow or a treatment cow, she had exactly the same dry cow therapy. Most of these farms use combo of antibiotic plus teat seal. I think they all did. 2 of them used a long-acting dry cow antibiotic product, and 2 of them used a short-acting. But again, that becomes a farm-level factor. It's subsumed within the total dustbin term of farm effect. Yes, it'd be nice to know where it did, but with only 4 farms, we're not going to be able to pull that kind of data out because it's the power of 4 is nothing. So it disappears into the farm effect, and all the treatment cows within a farm are the same. So there's no difference at the farm level between cows on one farm as to whether they get different antibiotics and different teat seals. Within a farm, all cows, whether they're treated or control, get the same dry cow therapy, but those may differ between farms. That's it, I think. Some nice people saying thank you. You're very welcome. Somebody's just written just. I don't know whether that was a start of something, but somebody said, hang on, in terms of being cautious around selenium and copper supplementation, were these cows on other supplementation while dry and lactating? And to what point is MULTIMIN out? Oh, I think it's okay. There's 2 bits of that. I think I get it. Okay, so during lactation, all the cows are on a water-based dosatron system, and it's very standard within our part of New Zealand. I can't remember the exact quantities. I can look it up if you're interested and get it to you, but it certainly doesn't go anywhere near toxicity. Over the winter, it's usually impractical for us to use those systems because the cows are on runoff blocks where they have plenty of access to non-drinking supply water, and also they just drink a lot less because they're not lactating. And so routinely what happens is that some farms will supplement with injections, some will supplement with boluses, and it does vary between farms. Again, like the dry cow story, it becomes part of the farm level effect. If there were major differences between the farms in what they did, that would distort that one farm's data, and that would cause us problems. But there weren't. They were basically doing very much the same thing, which is a shot of long-acting selenium at the start of the dry period, and then some form of selenium supplementation, usually in the form of short-acting injections as they come up to calving. And that's what those farmers did. Any small differences that there were would be subsumed within that farm level effect again. So we didn't have to worry. Then the question about, I think the question is about how long is MULTIMIN in the system and how rapidly can you re-inject? I think you're probably going to have to jump in with this one, Matt, because you'll be more au fait. From memory, it's about 3 months, I think, that the data you've got says it lasts. Is that right?
Yeah, 2 to 3 months. I'm not sure if you can hear me.
Can the others hear you?
I don't think so. I'm not sure what's happened.
Can you type and I'll write it and I'll say it? Yep, he's going to try that. So I'll come back to that one. Lots of people saying thank you. Thank you very much. That's very nice of you. Do you know when the farms typically start their water-based minerals pre-calving? Yep, very much when they come back from the runoff blocks. And theoretically, that's a fortnight before calving. But as you'll know, often it's a variable amount of time. It's based on drafting from udder development. And it's usually anywhere from 3 to 1 week to no weeks. So it's a variable amount of time. Again, there's no reason a priori to think that that will differ between treated and non-treated cows within a farm. It's a good point though, and ideally we would have known when each individual cow came back, but we didn't. Maybe I should have recorded that, but I didn't. But if there were major differences between when treated and control came back, that could have altered things. But it's unlikely that that would happen because nobody knew, apart from me, who the treated cows were and who the control cows were. So hopefully that wasn't a big deal. Just carry on going. Somebody else is saying Matt's very quiet. Here we go. Verback New Zealand. Yes, 2 to 3 months is fine in dairy cows. More people being ironic about Matt being this quiet. I think the general consensus is, Matt, don't worry to hurry back to speaking to us. That's about it. Yep. Okay. So 2 to 3 months seems to be the rule of thumb for how often you can give multimin. Certainly in the trial that we did with the calves, 1,000 calves, and some of them got 3 injections within the first 90 days of life, and nothing fell over. Now that doesn't mean it's safe, of course, but it suggests that it's not madly dangerous either. So that's just an Andrew thought rather than an official thought, but that's some information anyway. Matt's been looking at the data. Selenium levels at the time of multimin injection were all over 750 on average. Okay, so fairly normal, I suppose. Okay, another one. Back to the farm effect or lack thereof. What is your hunch on the baseline mineral status and the response to multimin? I don't know. I'd have to ask Matt that probably. I think it varies quite a lot with where they are. In our experience, the data we've got seems to be that how much the levels jump depends on where they are to start with. And I don't know. I find mineral testing in animals really frustrating because it seems so inexact, and no test is in any way, shape, or form perfect. Sometimes not even that useful when you sort of try to think about what it is you actually want to know. I have got the data of what they were before and after the start of the dry period. I wonder if I can share that with you. I can try. Here we go. Okay, I'll try doing this. Whoop. Matt, can you see my page? Yep. Okay, so the question was about mineral status of the animals, and here's a table on the. For me, it's on the right. Table 5. I hope you can see that. Can you see table 5? It says farm level statistics, summary statistics for minerals. And it's got, can you see that? Yep. Okay, so we've got serum selenium before dry off and serum selenium pre-calving of the 4 farms, and then differences between them. Okay, and then the control cows and the treatment cows, differences between them. So the take home that I took from this is that effectively, firstly, there's no difference in the mineral levels between the treatment and the control cows. That's these columns here. Okay. I know absence of difference is not the same as establishing difference or lack of difference, but for the sake of argument, with these overlapping confidence intervals and the levels that these things are and the closeness that they are and the value that a difference of 50 represents in question marks, in inverted commas, they are the same. Okay. So there's no difference between the treatment and the control cows in the level of minerals. And there is also no difference when you go from here. Well, these are the levels then of selenium before dry off in the treatment of control cows, and these are the levels of the selenium in cows pre-calving. So between columns, I'm saying they're the same. Between rows, I haven't checked because I'm not really. No disrespect, but from the point of view of the study, I'm not interested. All I want to know is that then this isn't confounding my treatment and control effect. But you could argue that the selenium levels have increased in both the control and the treatment cows. And you could argue here that they've gone down slightly as they got up to calving. So this is 28 days before calving, this is 28 days before dry off, and this is at calving. So you could argue that there's been some increase over the winter, perhaps in response to the injectable supplement, and then some decrease as they've come back from the runoff blocks and are just starting to get back onto their water supply. Copper, we've got the same thing, no difference between columns. and no difference here, I would argue, between different parts of the dry period, before the dry and after dry. And hopefully, here we go, just broken the page. No real difference here either between the levels at calving. Now, what does serum copper tell you? Nice question, I'm not really sure. But it was just a proxy, really, for trying to establish, for in our sense, that there was no difference between columns. That's what I was concerned about. I didn't want to have the control cows very different in status than the treatment cows. Now, you could argue a lot about what the status means. Does it mean anything? But what I'm saying to you is they are the same. Whatever this means, it's the same between the treatment and the control cows. Hope that helps. And answers that one. Let's see if it comes back. Oh, thank you very much, Coconut Club Bar. Sounds like a good place to be. It was a random sample. Somebody's asked, was it the same 10 animals that were sampled each time? No, it wasn't. It was a random sample because, again, I wasn't interested in trying to quantify the effect of trace mineral supplementation for individual cows. I was trying to guesstimate the status of the herd, whatever that means. And I accept that that's a, sort of big wavy army thing to say, but essentially that's what we were trying to do. We're just trying to say, are the herds in the study relatively normal and relatively the same treatment and control? And that's why we did it. So we were interested in a herd level measure rather than a cow level measure. So no, we didn't select the same 10 animals. In case, for example, we selected 10 rogues who were really different from everybody else. Oops. Okay. Oh. There's a question here. I don't know if you can see it, Matt. There has been some economic work. Matt's done it, but he can't talk to you. Certainly, I think if you Matt's probably going to type, and so I'll yeah, Matt's typing, so maybe I'll wait. He has said, you can put some estimation in SmartSam gap calculator, quite large returns, about 3 or 4 to 1 on investment. And there's some more coming, I think. I guess the key here is that these differences were found in the face of sufficient supplementation and mineral status, right? And that's quite right. And you're right to put sufficient in inverted commas as well. So do you think you could possibly see greater effects in farms that aren't quite as good as your Canterbury farms? I've got to be honest, I don't know. It could go either way, and I don't know enough about anything to sort of guesstimate whether it'd be worse or less good. You could say that in farms where they were more deficient in minerals, adding extra minerals through TMS might be really helpful. But my understanding really is that the way we think that this kind of trace mineral supplementation works is through like the top-up analogy, where effectively we're saying in cows which have a frank deficiency, a real shortage, you are unlikely to see much of a health-related effect from supplementation, because the argument goes that extra minerals in that situation go to the fundamentals of life, if you like, that they need the minerals for first and foremost, which is probably things like feed conversion and growth and stuff. And again, the argument is, I think, that as you continue to supplement animals, you get into these sort of marginal discretionary areas of benefit, which are things like immune status. And so I suspect that in animals that were really deficient in minerals, you would not see the same level of response. You'd probably see less, because the animals have got more things to worry about, I suppose, if you like, than trying to boost their immune system. Now, that's a pretty unscientific way of trying to explain it. I'm trying to read Matt's body language as to whether he's pulling his hair out. Now he's giving me a thumbs up. So hopefully that's right. But certainly that would be my hunch, that yes, if you have animals that are really deficient, then you need to sort that out first before you can expect to see any kind of benefit. And I think, to be fair to them, Virbac position MULTIMIN as a top-up product rather than as a copper bullet equivalent or as a long-acting selenium equivalent. I don't think they position it in that space at all. Okay, can a percentage be put on the likely reduction of clinical mastitis in cows with Can a percentage be put on the likely reduction of clinical mastitis in cows with an SCC over 150,000 by comparing the control and supplemented groups? Yes, it can. That's what we were, with respect, that's sort of what we were doing. Hang on, let's see if it will work. So hopefully you can see this. So the subclinical mastitis, the cows, here's your reduction in percentage. We are in this farm, on these farms, the percentage reduction was 4%. But if you're wanting a figure that you can sort of take away and expect to get on other farms, then you need to look at the odds ratio, which was 0.72. Now, bear in mind, odds ratios are transferable. You can transfer that, if you like, from study to study with some caveats, which we'll cover in a minute. They're transferable because they're not dependent on the level of the disease that you've got on your farm. But when I turn it into a probability, because probability is easier to think about than odds ratios, this figure here, this 4%, is dependent on how much mastitis these 4 farms had. If you had 12% mastitis on your farms, you might still see an odds ratio of around about 0.72, but the difference in the actual percentage drop would differ, because odds ratios depend on the level of probability to start with. So they depend on how much mastitis you've got, because remember, it's the probability of event over the probability of not having the event. So the probability, how much mastitis you have on your farm, is important. So these probability figures that I've shown you are what we got on these farms, on this study, on these farms. To try to give you some handle of how transferable that is, I've also given you odds ratios, which to some extent you can transfer. The big caveat with that, as I sort of hinted earlier, is that, of course, like all studies, it's just one study. And because we found an odds ratio of 0.72, it doesn't guarantee at all that you will, when you do it on your farms with different situations and different circumstances, different weather, different feeds, different cows, different feeding. It is just one study. And no one's trying to teach anyone to suck eggs, but one study can only be like a tiny step in a path. And you have to look at it and say, is it credible or is it not, and all the rest of it. And then you have to look at other studies that are out there. Are they similar? Do they show similar results? If you start to get a chain of studies that show similar things, then I start to think, yeah, there's probably something in it. So by all means, you might think you get 0.72, but it would really depend on how similar your situation was to the situation that we had on these 4 farms. I hope that helps. There is another study, isn't there, Matt, from the States, I think, where they got a reduction in mastitis and subclinical mastitis. And I think it's in one of the Virbac technical bulletins. I've seen it. So there is. To be fair, Dave Hawkins did a really nice study with MULTIMIN several years ago now, looking at giving it pre-calving and looking at repro. They also looked at mastitis, and they didn't find an effect. So again, you get some studies that show an effect and some that don't. One of the things that we found interesting was that our effect definitely tails off. And so I think it does depend on when you look at it as to how likely you are to find it. And the longer the period of looking, the less likely you are to see it, because it will get swamped by the cows getting mastitis, which are no longer protected by MULTIMIN. So the period for which you look is quite important. So hopefully that's answered that question. There's another one. If we saw the same effect, it would be roughly having, oh yeah, Matt's written that in, that's great. So he said, in summary, if we saw the same effect, it would be roughly halving the clinical mastitis and a 25% reduction in subclinical mastitis. Yeah, that's right. So, as always, I've used about 400 words where maybe 20 would have been sufficient. It's the trouble of talking to yourself to a screen. Someone is typing. Okay, Matt's suggesting, apologising about the sound, and I hope the rest of you have been able to hear. Otherwise, I really have been talking to myself. But we'll probably call it quits now. If anyone does want to get in touch, you're very welcome, Matt, to give my email. It's in public anyway, so if you want people to email me, that's fine. Or you can definitely get in touch via Verbeck, I'm sure. But thank you ever so much for listening. Thank you very much for the questions. It's always nice when you get some questions and the interest. And I hope it's been useful, and very best of luck in the winter and the spring.